Hello, my name is April Smith-Cook. I'm the Presumptive Eligibility Coordinator, and today we will be discussing presumptive eligibility. This training course provides an overview of the presumptive eligibility programs, the functions of the Indiana Health Coverage Programs portal, also known as IHCP, related to becoming a qualified provider, and presumptive eligibility enrollment for eligible applicants. Our agenda for this training is first, we will do an overview of presumptive eligibility. We'll discuss the covered benefits and also talk about qualified providers, how to become a qualified provider, completing the PE application, other resources, the current presumptive eligibility standards, and questions. Before we begin, I would just like to talk about some acronyms that you may hear throughout this training. The first one is FSSA, that is Family and Social Services Administration. Next is OMPP, the Office of Medicaid Policy and Planning. We also have DFR, Division of Family Resources, PE, which is Presumptive Eligibility, QP, the Qualified Provider, IHCP, Indiana Health Coverage Programs, HIP or HIP, the Healthy Indiana Plan, FPL, the Federal Poverty Limit, TANF or TANF, which is Temporary Aid for Needy Families, FFS, which is Fee for Service, IAC is the Indiana Administrative Code, SSN, Social Security Number, RID or RID is a Recipient Identification Number, AR or AO is the Authorized Representative or the Authorized Organization. So let's discuss the presumptive eligibility process overview. So what is presumptive eligibility and why is it important? Presumptive eligibility allows uninsured or underinsured individuals and their families to obtain temporary coverage quickly. They can get care immediately. PE allows providers to be reimbursed for services covered by the benefit package provided immediately after PE approval. During the PE period, the individual is able to receive treatment from other Indiana Health Coverage Programs, IHCP providers. Presumptively eligible individuals must still complete a full application to determine eligibility for continued coverage. We also have presumptive eligibility for inmates. That is limited to inpatient hospital services only. What services are covered? The specific PE benefit plan to which an individual is assigned is determined during the application process. Based on the criteria for various aid categories, individuals are determined to be presumptively eligible and assigned to benefit plans accordingly. During an individual's PE period, the IHCP provides reimbursement for all services covered within the designated benefit plan. Presumptive eligibility benefit plans. The first plan is the Presumptive Eligibility Package A Standard Plan. That plan is for infants and children. We have Presumptive Eligibility Adult, which is the HPE plan. That is for adults between 19 and 64. We have Presumptive Eligibility Family Planning Services only. We have Presumptive Eligibility for pregnant women and Medicaid inpatient hospital services only, which is the inmate category. So the presumptive eligibility aid categories are infants, children, parent caretakers. Now, low-income parent caretakers and those over the income limit may qualify for adult PE instead. Former foster children, pregnant women, family planning, and adult. For more information regarding this benefit plans and the categories, please go to the PE website. So, who is eligible for presumptive eligibility? To qualify for presumptive eligibility, applicants must be a U.S. citizen, qualified non-citizen, or qualifying immigrant with one of the following immigration statuses: a lawful permanent resident immigrant living lawfully in the United States for 5 years or longer, a refugee, an individual granted asylum by immigration office, a deportation withheld by order from an immigration judge, an Amerasian from Vietnam, or a veteran of the U.S. Armed Forces with honorable discharge. To qualify for presumptive eligibility, applicants must also be an Indiana resident. That Indiana address must be provided on the application, not currently enrolled in any IHCP program, which includes the Healthy Indiana Plan or HIP or conditional HIP status. Now, the Medicaid review team, which is MRT, and pre-admission screening and resident review or PASSR coverage are the only exceptions to this rule. Individuals who recently applied for Medicaid but have not yet received a determination may apply for PE to cover services while the IHCP decision is pending. You also cannot be covered by any PE benefit plan currently or within the last 12 months, or if pregnant, not had PE coverage during the current pregnancy. Not be currently incarcerated, not be an adult, ages 21 to 64, admitted to or residing in an institute for mental disease, and you have to meet the income-specific requirements outlined in Table 1, as well as any additional requirements specific to the applicable aid category. Presumptive eligibility income standards. As you see on this table, each category has a specific FPL or federal poverty line limit. For infants and pregnant women, that income limit is 213%. For children ages 1 to 18, it's 163. For parent caretakers, it's converted to TANF limits, so very, very low income. For family planning, it's 146%, and adult is 138%. Now, these percentages included in the table also have a 5% income disregard. So when completing a full application, the 5% disregard will only be applied if the individual is otherwise eligible for the IHCP. To the side, we have how to calculate to get monthly income. As a reminder, you need to use gross income. And so if you have the gross monthly income, please use that. Presumptive eligibility covered benefits. Presumptive eligibility benefits and coverage limitations. So for the Package A standard plan, it's a full coverage benefit package. So that means all IHCP services are covered, and that is for infants, children, the low-income parent caretaker, and former foster children. This is a fee-for-service delivery system. Presumptive eligibility and coverage limitations for pregnant women is limited coverage for ambulatory pregnancy-related services. So some examples of covered services are prenatal care, including pregnancy-related labs and prescription drugs, outpatient services, immunizations, transportation for pregnancy or emergency-related care, mental health, and dental services. Services that would not be covered are inpatient care, labor and delivery, postpartum care, abortion services, sterilizations, hospice, long-term care, and services unrelated to pregnancy or birth outcome. This is a fee-for-service delivery system as well. For presumptive eligibility for adults, it's limited coverage that mirrors the HIP basic benefit plan. So some examples of covered services are ambulatory services such as physician services, outpatient surgery, dialysis, emergency services, hospitalization, mental health and substance abuse, prescription drugs, rehabilitative services, labs and x-rays, preventive care, and hearing aids. Some examples of services that will not be covered are dental, vision, bariatric, and treatment for TMJ disorder. The only exception to the dental and vision services rule would be for 19 and 20-year-old members. We allow one routine vision and one routine dental exam that will be covered per year. Again, this is a fee-for-service delivery system. Presumptive eligibility family planning services only. That is a limited coverage for services and supplies intended to prevent or delay pregnancy. Examples of covered services: sterilization services, annual family planning visit, oral contraceptives, including necessary related lab services, initial diagnosis of sexually transmitted diseases or sexually transmitted infections, HIV screening, pap smear, limited history, and physical exams. This is also a fee-for-service delivery system. Presumptive eligibility for inmates is a coverage that is limited to inpatient hospital services only through the fee-for-service delivery system. For more information, see the PE for inmates page at the Indiana Medicaid provider website. Qualified providers. Here's a list of the provider types that can be QPs for PE or qualified providers for PE. Please review. Any providers that you see an asterisk by means that they can be a qualified provider for low-income pregnant women, aka PEPW. QP requirements for presumptive eligibility. We have federal Medicaid regulations, which is hospitals and other QPs must participate as providers under the Indiana Medicaid state plan or demonstration under Section 1115 of the Social Security Act. The QP must notify the IHCP of its intentions to make presumptive eligibility determinations. The QP must agree to make presumptive eligibility determinations consistent with state policies and procedures. State requirements. So the QP must participate in presumptive eligibility IHCP provider healthcare portal training. The QP must participate in presumptive eligibility training. The QP must complete and submit presumptive eligibility QP attestations via the IHCP portal. The QP must encourage individuals to complete and submit a full Indiana application for health coverage. Any person can help the applicant apply using the Indiana application for health coverage. However, to receive additional information, said person will need to be an authorized representative for the applicant. Performance measures. So we have specific performance measures for our QPs, which is 95% of applications completed. That's the percentage of presumptively eligible members who complete the Indiana application for health coverage. And 95% are completed correctly, and 95% determined eligible, and that's a percentage of presumptively eligible members who are subsequently determined eligible for full eligibility under an IHCP program such as traditional Medicaid or HIP. When I say completed correctly, that means reporting to DFR, all members, income, etc. And as you see, the asterisks denote the metrics that will be measured for compliance. Here's an example of the report, which is a hospital presume eligibility and presume eligibility programs by specialty. So when you review the report, it will be like this example. The yellow highlighted headers are percentages, and those will be the ones that count in the metrics. In the example, Kingston Falls Mogwai location, of the 70 PE applications approved, 50 had submitted the full Medicaid application, equaling 71%. Of those 50, 30 were approved, 10 denied, and still 10 pending. Now, an Indiana Medicaid application is completed when you submit the application form and all required supporting documents to the Division of Family Resources, which is DFR. This includes providing personal information like names, dates of birth, and Social Security numbers, as well as financial and residency documentation. Once the application is complete, the DFR will process it to determine your eligibility, which can take up to 90 days. An application can be completed in the following ways: online in the benefits portal, in person at a DFR office, or by phone. And as a reminder, 95% of the approved applicants must apply for Medicaid, and 95% of the Medicaid applications are approved or not denied for being ineligible. Non-compliance on the part of the applicant and duplicate applications will not count against the provider. PE metrics. So the first evaluation quarter will be quarter 1, 2026, which is January through March. If the performance measurements do not meet the 95% threshold, the following will occur. The first time, your facility will receive a warning letter. The second time within that 12 months, your facility will receive another warning letter and mandatory training. The third time within the 12 months, you will no longer be able to complete PE applications. These metrics are reviewed quarterly. If you fail more than once in a quarter, currently it will only count as one fail. As a reminder, duplicate RID denials and non-compliance reason denials will be excluded from the metrics starting January 1st of 2026. If a provider decides they need to appeal the decision, they will use the same appeals process as any other provider appeal. How to become a QP for PE. Eligible providers must affirm the following: that the organization understands and will abide by any published guidance regarding the performance of PE activities, that the organization will not knowingly or intentionally misrepresent client information in order to inappropriately gain PE, that the organization understands that all PE QP enrollment activities undertaken by this organization must be performed by an organization's employee or designee. As a note, enrolled QPs and their staffs may not perform PE determinations for other non-QP providers, such as physician groups or dentists. To become a QP, providers must first complete a pre-qualification process by updating the provider maintenance presumptive eligibility page in the IHCP provider healthcare portal. When using the IHCP portal, a provider with an eligible provider type and specialty can update the provider maintenance presumptive eligibility page by following these instructions. First, log into the portal. Second, on the My homepage, click Provider Maintenance. Third, click Presumptive Eligibility Changes. Fourth is read the information and answer the 3 questions using the radio buttons. You can see the example to the right. Now, depending on the provider's type and specialty, the provider will either see the Presumptive Eligibility panel or the Presumptive Eligibility for Pregnant Women panel. Step 5 is to provide the name and email address of the individual responding to the questions. Step 6 is to review the information for accuracy and click Submit. Clicking Submit completes the pre-qualification process and provides a tracking number. Then you click Exit to return to the provider maintenance page or log out of the IHCP portal. When the pre-qualification process is complete, the provider immediately receives an automated email notification with their PE QP status. A provider relations field consultant will contact the pre-qualified QP within 10 business days to schedule the IHCP portal training. The provider relations field consultant will also provide the QP with a link to the PE process training presentation. After the IHCP portal training is complete, the provider relations field consultant activates the provider's PE certification status with effective end dates in core MMIS. The QP may then submit PE applications via the IHCP portal and provide PE determinations to qualified individuals. How to locate a QP. So after being certified, a provider's QP status is evident for members searching for an IHCP provider. They can call the Provider Relations Customer Assistance number, or they can go to the IHCP website and search the provider locator. And members can access the same provider locator by clicking Find a Medicaid Provider on the homepage of the member website. Completing the presumptive eligibility application. Medicaid fraud. Medicaid fraud is defined as the intentional deception or misrepresentation made by a person either a provider or recipient, with the knowledge that the deception could result in some unauthorized benefit. This definition includes actions considered fraud under federal or state law. This means that intentionally omitting information that would result in eligibility from a PE application can be considered Medicaid fraud, especially if there's an identifiable pattern. When we suspect fraud, we are required by Indiana Administrative Code 405 IAC 2-3.4-3 Section 3E to refer the provider to our program integrity team for investigation. As a word of warning, the presumptive eligibility member application system is a live production environment. Providers should not create test cases and use the live application for training purposes. Per the provider's attestation during QP enrollment, the organization will not knowingly or intentionally misrepresent client information to inappropriately gain presumptive eligibility, and providers must not click submit multiple times on one application. Using the IHCP portal, a QP can guide an applicant through the PE process by these following steps. The first one is to use the eligibility verification request feature to verify that the member is not an IHCP member. So you log into the portal. You click the eligibility in the menu bar. And then you search for the member and effective date or dates when the service will be provided. As a reminder, you can only see past and current dates. This is also a required step and not optional. If you do not complete this step, it will result in discrepancies that will hurt your metrics. So the results of the member search. Using the IHCP portal, a QP can guide an applicant through the PE process by following these steps. So if there is no active coverage found for the individual, you would click the appropriate PE application button and then complete the PE application. Provide as much information as possible on the application. Required fields are marked with an asterisk. Our required fields are first name, last name, date of birth, address, city, postal code, county, gender, Indiana resident, incarcerated, pregnancy, number of people in the family, U.S. citizen, family income, and foster care on 18th birthday, or do you live with at least one child under 18 years of age, and are you the main caretaker? Now, while it is not required, we strongly encourage using the Social Security number. We also recommend using the full name as it appears on the SSN card. This will prevent creating duplicate RIDs and increase the percentage of your compliance metrics. Some additional requirements for presumptive eligibility for pregnant women. If the QP is determining presumptive eligibility for a pregnant woman, the application will vary slightly. Provide as much information as possible on the application. Required fields are marked with an asterisk on the IHCP portal. Again, required fields: are you an Indiana resident? Your first name, last name, date of birth, address, city, postal code, county. Are you incarcerated? Are you pregnant? Number of people in the family. Are you a U.S. citizen? And what is your family income? Again, we strongly encourage the use of the applicant's Social Security number to prevent the duplication of PE. Presumptive eligibility considerations. Before clicking submit application, providers should carefully review all information with the patient to ensure that it has been entered correctly, which is checking the spelling of the patient's name, the correct date of birth, and so on. After the application is submitted, the provider cannot make corrections. QPs are required to aid applicants in complying with the IHCP regular application process. For example, documentation submission for determining full eligibility. As a note, If the member's name, address, or date of birth is accidentally or inadvertently entered incorrectly during the application process, the provider must contact the presumptive eligibility mailbox to have the information corrected. When submitting a request for correction, please include all information needed. Please always include the PE and/or eligibility RID. As a reminder, please remember to do the following for best search results. Enter as much information as possible to find the existing RID. This will help to not create duplicate RIDs and benefits applicant is not eligible for. Asking for applicant SSN and full legal name will increase the chance of not creating duplicate RIDs for the same individual. This will also make sure that the existing RID will be linked to the IHCP application. Please be sure to ask the applicant if they've recently applied for Medicaid before applying for PE. If the application is in process and denied, it will close PE out on that date of denial, and the PE will not be extended. We also recommend that you have the member create an authorized representative form and select application only. This will ensure that you are getting notices from DFR and are able to follow up with the member from the beginning of the PE coverage until a decision is made on the Medicaid application. Now, there's no provision in federal regulations for removing PE due to an error or mistake found later. We can only void the PE if the person has Medicaid, because that Medicaid coverage is better than PE. Completing a presumptive eligibility application summary. So after you review the information in the application for accuracy, you click the attestation statement box in the disclaimer section at the bottom of the application to enable the submit application button. When you're ready to submit the information, click submit application. Please make sure the applicant remains with you while completing PE. You should be printing the applicant a copy of the acceptance letter and handing it to the applicant. After you submit the application, an immediate determination is given in a pop-up window. So follow the directions in the pop-up window. Print the summary page for information, print the acceptance or denial letter, and close the pop-up. As you see below, we have two examples of what the pop-up looks like. Presumptive women approval and denial letters. Here's an example letter of what you would see for a PEPW approval, as well as a PEPW denial letter. Here's an example of the adult approval letter and the adult denial letter. Here's an example of the PE approval for a child and a PE planning letter example. So the next steps after presumptive eligibility application approval, the QP should inform the PE member of their coverage, including limitations such as covered and non-covered services of the presumptive eligibility benefit package, especially presumptive eligibility family planning services only, presumptive eligibility for pregnant women, and presumptive eligibility for adults. There is a delay with pharmacy benefits. It can take 24 to 48 hours to be seen in the portal, the coverage period, and guidance for how the provider will help the member complete the full Indiana application for health coverage. The QP should inform the member of the coverage period and conditions. If the individual does file an Indiana application for health coverage, the presumptive eligibility period will last until a final eligibility determination from the Indiana Family and Social Services Administration has been made. If the individual does not file the full application, coverage ends the last day of the month following the month in which the presumptive eligibility status is granted. Now, during the presumptive eligibility period, the eligible individual will be able to receive treatment from IHCP providers other than the QP. The member should present the PE approval letter as proof of eligibility. Presumptive eligibility coverage begins the same day as a QP determines an individual to be presumptively eligible. Presumptive eligibility is terminated the last day of the month following the month in which the presumptive eligibility status was granted if no Indiana application for health coverage is pending with DFR. So, for example, if an individual is determined presumptively eligible on July 14th and does not submit an Indiana application for health coverage, the presumptive eligibility coverage will end August 31st. Now, it is imperative that the QP inform the individual of the need to complete the full application before the temporary eligibility period ends and provide information about how the applicant can do so. As explained in the acceptance letter, the individual may complete the Indiana application for health coverage in person at the location which the individual was determined presumptively eligible, in person at the local DFR office, online through the FSSA benefits portal, or by phone with DFR. Qualified PE organizations may apply to be authorized representatives or application organizations. QP staff members or the QP's designee helping consumers complete the Indiana application for health coverage also need to be certified as Indiana navigators or designated as authorized representatives. Only in those roles may the organization staff assist with the presumptive eligibility participant with their Indiana application for health coverage. This does not apply to who can complete the PE application. DFR responsibilities. The DFR makes all final eligibility determinations. If the individual application for health coverage is received by the DFR before the last day of the month following the month in which the presumptive eligibility was approved, the individual's presumptive eligibility coverage will not end until the DFR's determination is completed. This ensures there is no gap in coverage. If the Indiana application for health coverage is approved, presumptive eligibility is terminated on the day after IHCP benefits begin. The core MMIS system receives eligibility determinations and updates from DFR on a daily basis. We also have the eligibility verification system, known as EVS. The EVS communicates information about presumptively eligible members the day following the determination by the QP. The information about the determination is available by using one of three sources: the IHCP Provider Healthcare Portal, the Interactive Virtual Assistant, known as GABI, or the 270 and 271 transactions. Here's an example of looking in the portal for eligibility verification. First, you want to type the member's information into the eligibility verification request screen, as you see in the example, and then the benefit plan name appears in the coverage column, which is highlighted in red. Other resources. QPs are encouraged to review the presumptive eligibility provider reference module for additional details about the program, such as information about navigators, determining family income, determining family size, as well as eligibility examples. The IHCP presumptive eligibility standards. This is the PE income chart. It is broken up over the next 3 pages. As you see, it shows for the family size and category what the monthly income maximum amounts are. This chart is up to date as of March 1st of 2025. It also gives you the general presumptive eligibility applicant requirements, as well as the adult requirements. If we continue on, it will give you the eligibility period, the frequency limitations, and the PE benefits. As a reminder, all PE benefits are fee for service. The last section of that PE income standard document, just as a reminder about completing the Indiana application for health coverage. And then for more information, to go to the Presumptive Eligibility Provider Reference module. The PE income standards are updated every March. So to download the most up-to-date income chart, please visit the link listed below. Do you have any questions about the topics covered today? We discussed presumptive eligibility overview, the covered benefits, qualified providers, how to become a QP for PE, completing the PE application, other resources, and the IHCP presumptive eligibility standards. If you have any additional questions, please submit your questions to the presumptive eligibility mailbox at presumptiveeligibility@fssa.in.gov. Thank you.